May I call the room to order, please? Excellencies, ladies and gentlemen, welcome back to the conference room. I hope you had a nice evening in Geneva yesterday, and I look forward for another productive day and hope you contribute as actively to our discussions as yesterday. I would also like to point out, before we start with this second thematic session, that the Secretariat and I have been busy working on the chairman's summary. We are expecting to be able to distribute to you a first part of the chairman's summary that would contain the first day, yesterday's day, and that means including the first thematic session of yesterday and the second thematic session this morning, just before the lunch break, so that you will be able to have already a look and you are able to study already my summary during the lunch break that will be here, the sandwiches being distributed here. So just before lunch break, you should be able to have already the first two thematic sessions, including the opening in the chairman's report. Again, I invite you, if you have comments on the summary, which at the end is a summary of what has been said here during this conference, and which is on my own responsibility. But any comments of you are most welcomed. Please take time to see me or the Secretariat in rooms 10002 or 10008 on this same floor behind conference room 17. But now, without further ado, let me open the second thematic session on families, sexual and reproductive health over the life course. As yesterday, again, this thematic session will be chaired by a moderator, and it is indeed my pleasure to introduce to you Ms. Renate Bähr, Executive Director of DSW. Madame Renate Bähr is also member of the high-level task force of the ICPD. She has a long-standing record of successful advocacy, policy, and public awareness-raising work in the field of global health and sexual and reproductive health in Germany and Europe. She played the lead role in establishing DSW's Parliamentary Advisory Committee in 2003. And just to highlight her long-standing experience and contribution to the ICPD, it is enough to mention that she already participated in the International Conference on Population and Development in Cairo in 1994. So with this introductory remarks, it's indeed a pleasure to invite you to take over this thematic session and chair this thematic session. I wish you all the best, and I expect the audience to support you in your task, and I wish the panel well for that. The session then will be closed by the Vice Chair, Minister Wovchenko, who I'm inviting later to join the panel and close this session and open the next thematic session of this morning. Thank you very much, Minister. Madam Bähr, the floor is yours.
Yeah, thank you, Mr. Chairman. I was more than happy to agree when I was invited to share this session, which is mainly about sexual and reproductive health and rights, which goes really into the heart of the ICPD, which, as you heard, I participated in now 19 years ago. So I really don't want to lose time. I really want to jump into this session to make most use of it, and would like to introduce our keynote speaker for this session, who is Latanya Mapp Frett, next to me. She is the Vice President of Planned Parenthood Federation of America and leads its international arm, the Planned Parenthood Global. She is the Federation's international spokesperson and serves on the executive team of the organization. Mrs. Frett previously worked as a human rights officer for UNICEF and for another 10 years for USAID. She is a Woodrow Wilson Fellow and author of 4 UN human rights reports and manuals. And we met first 1 month ago at Women Deliver Conference. It was the first time, and when we departed, I said, I'm pretty sure our paths will cross soon. At that time, I didn't know that we will sit next to each other at this important conference and that you are the keynote speaker, so I'm more than happy. The floor is yours to give us the keynote and some inspiring ideas on the topic.
Thank you very much, Renate. It is a pleasure for me to be here and represent Planned Parenthood Federation of America, which is a member association of the International Planned Parenthood Federation. We are the U.S. member, and we have more than 71 affiliates across the United States. And we have a little more than 750 clinics where we serve women, girls, and their families. So it is indeed, for me, a pleasure to be able to come. And while we have programs throughout Africa, Latin America, and some in Asia, my focus today is really going to be to speak to the U.S. experience as part of our movement and push towards ICPD 14, as well as the new Millennium Development Goals, as we look to how we can continue to play a role. We've come a long way since Cairo. We've heard many stories where the global leaders gathered and there was a lot of momentum built, and for the first time linked reproductive health and sexual health with human rights. And so since that work has been done, we've done a lot to shore up those rights and to make sure that those rights were protected. In my own country, I'm really happy to talk today a little bit about our new Health Care Act, the Affordable Care Act. It really is a historic moment for us, particularly Planned Parenthood in the country. The government just confirmed the guidelines for the Affordable Care Act that everyone must have access to birth control at no cost, no matter where they work. I know yesterday we heard from some countries, like the story from Romania, where this is a given. Also, I know in many other countries. But for us in the United States, this is a very, very important time. For Planned Parenthood, we have been providing contraception to women for almost 100 years. And so we know the transformative effect that it has to be able to provide these services for women and for women's empowerment. And so our goal is to continue as we move towards ICPD, to continue to move forward and not turn back the clock, that we find ourselves in 2014 in a better position than we were at Cairo, not in a worse position. So for women's health, for economic security, birth control has to be a basic human right for women, and it also has to be taken like any other preventative care that we look at, because we know that it is going to impact their health, their education, and their economic opportunities. So With that said, I just want to, take a little bit of time to look at the context. I mean, the Center for Disease Control and Prevention in the United States actually said that birth control has had such a dramatic impact on women and families that it is now the top 10 public health achievement of the century. Providing birth control at no cost, like I said, everywhere else, is going to significantly reduce unintended pregnancies in the United States. But more importantly, it's going to reduce the abortion rate in the country. Women will also be more likely to seek prenatal care, thus improving their overall health and that of their children. So the Affordable Care Act will bring a huge cost saving for women and their families. I mean, currently, just to give you some context, in the United States, the cost of birth control pills range from about $15 to $50 a month. So that's upwards of $600 a year. And I'll just tell you quickly, I have a young cousin who's now in college, and she told me one day that she had to make a decision between her birth control for the month or paying her cell phone bill. I'm a little embarrassed to say that she still has her cell phone. So I think that the birth control took a sideline because of the cost. And I personally can attest that there's co-pays and other out-of-pocket expenses for long-term contraception, such as IUDs in the United States, that are significantly high and out of reach for many women. But there are still some in the U.S., a small but vocal minority in Congress, in fact, who are doing everything that they can to reduce the availability of birth control. Among the key facts that they can't deny is that 99% of American women at some point between the ages of 15 and 49 are sexually active and use birth control at some point, and a majority of Americans believe that insurance should cover these costs, just as they do for any other preventive care service. But they continue, so I'd like to show you a, let me just say our work is not done before I go on quickly. We do know that in cases as in Cevita or Beatrice in El Salvador, that there is so much to be done. We have to stop these tragedies from happening, and I think this is the opportunity to do that. And I thought one of the ways to show you was a short clip of how former Secretary Hillary Clinton addressed some of these issues to her opponents.
Sound is missing.
Sound. Give us a second, so. Is there any way to unmute the sound? Okay. Technology can be our friend sometimes. Sometimes it can be our foe. So should I move on? Yeah. I don't think we'll have sound, unfortunately. It's a pretty dynamic setting, and I see Margaret Pollock just walked in. She was probably in the room at this time, but it was an opportunity in 2009 for the secretary at that time to talk about some of these issues. And I thought it was good to show this because we really are in an exciting time. We're at a crossroads now. As we talk about moving towards ICPD plus 14, and we're at the, should I try again? Yes, please. Okay, all right.
My question, is the Obama administration seeking in any way to weaken or overturn pro-life laws and policies in African and Latin American countries, either directly or through multilateral organizations, including and especially the United Nations, African Union, or the OAS, or by way of funding NGOs like Planned Parenthood? And secondly, and so we can have total transparency, you know, as a former lawmaker, we always have definition pages when we write legislation. Definitions do matter. Does the United States definition of the term reproductive health or reproductive services or reproductive rights include abortion? I yield to the distinguished gentleman.
Congressman, I deeply respect your passionate concern and views, which you have championed and advocated for over the course of your public career. We obviously have a profound disagreement. When I think about the suffering that I have seen of women around the world, I've been in hospitals in Brazil where half the women were enthusiastically and joyfully greeting new babies, and the other half were fighting for their lives against botched abortions. I've been in African countries where 12 and 13-year-old girls are bearing children. I have been in Asian countries where the denial of family planning consigns women to lives of oppression and hardship. So we have a very fundamental disagreement. And it is my strongly held view that you are entitled to advocate, and everyone who agrees with you should be free to do so anywhere in the world. And so are we. We happen to think that family planning is an important part of women's health, and reproductive health includes access to abortion that I believe should be safe, legal, and rare. I spent a lot of my time trying to bring down the rate of abortions, and it has been my experience that good family planning and good medical care brings down the rate of abortion. Keeping women and men in ignorance and denied the access to services actually increases the rate of abortion. During my time as First Lady, I helped to create the Campaign Against Teenage Pregnancy. And while we were working to provide good information, access to contraception, and decision-making that would enable young women to protect themselves and say no, the rate of teen pregnancy went down. I'm sad to report that after an administration of 8 years that undid so much of the good work, the rate of teenage pregnancy is going up. So we disagree, and we are now an administration that will protect the rights of women, including their rights to reproductive health care.
Thank you. So again, I thought that that would be poignant to where we are in the United States and where we're headed. And at this time, you know, as we walk into almost 20 years past Cairo, and as we look at what the new development goals are going to be going into the next decade, now is a really good time for us to reflect on how we boldly insist that the needs and rights of women and girls are not just included, but they're going to be center stage on the agenda. We're thrilled to report that the high-level panel of eminent persons has now set out a draft agenda, and we see that there's explicit reproductive health targets included. And we want to make sure that that's maintained and fully articulated in the final UN Post-15 Development Agenda. So, you know, more than 15 years, I guess, certainly more than a decade, countries around the world and the UN agencies have joined forces to eradicate poverty. And the MDGs, as you know, has been a very, very important policy guideline for many of us to do our work. But I think most of us remember in 2000 when they were developed that reproductive health was forgotten. And it was not until 7 or 8 years later that it was included as a fully, or at least fully articulated as a target. And so during that time, evidence has shown that there were some real losses in the response to reproductive health and its integration into primary health care efforts around the world. And so we're at this point where we know now, after looking at all of the studies and the many efforts that all of us have taken in our countries as well as other countries, that women have to have reproductive health at the center of their health care reforms. So seeking family planning should not just be part of a one-off programs that we have in our countries. They have to be integrated. And integration, yes, does mean that it's a part of when you go for your HIV screening, you should get family planning. Vice versa, when you go for family planning, you should get HIV screening. But there are so many other efforts that we have to integrate. So when we talk about family planning integration or RH integration, it has to also include the many faceted programs that women need. And as we talk more about what those needs are, education, economic empowerment, those are the integration with family planning that we have to talk about and that are at the middle of the Sustainable Development Agenda. So the crux of the high-level panel's report on the new development goals is to leave no one behind. And I thought this was a perfect opportunity to talk about some of these cross-cutting themes and what that really means, particularly for the most marginalized and vulnerable people. So for Planned Parenthood, leaving no one behind will require addressing the needs of individuals and families holistically. And to do this, we must look to local partners and innovative solutions. So when we talk about the integrations, our conversations don't end at just the services, but talk beyond them, to talk more about the realities of women's complex lives in so many places around the world. And in particular, young people everywhere struggling to get access to information and services that they need. We must help get it to them, and we must support, in particular, those that come from these most marginalized communities. In my country in particular, new immigrants are among those most cut off from the healthcare system. Similarly, women living in the Deep South, in particular African American communities in the U.S., face a dearth of resources to sever. It is easy to forget that they live in one of the most wealthiest and developed nations in the world because their statistics for maternal and infant mortality are so high. And to address these needs for the first time in history, Planned Parenthood is partnering with the government and local organizations to help build health centers that will increase their access. So partnering with local communities and partnering with governments is going to be very important to make sure that marginalized communities continue to be a part of the sustainable plan. So leave no one behind means just that, no one. As we move forward in defining development goals, the cross-cutting theme must continue to include the rights of individuals and families of all stripes. We're happy for many of us in the United States to see a recent Supreme Court ruling confirming marriage of same-sex couples. And we talked a little bit about that yesterday, but it's so important to understand the value that that's going to have on families and for children and reproductive health rights and needs as we go forward. Young people, of course, is included in this, and I'll talk more about it. And I think we had a very rich conversation yesterday about the elderly and the aging population and how these must be included in new sustainability goals as we go forward as well. But a focus on young people is critical to investing in the future and breaking the cycle of poverty in particular. So when we talk at Planned Parenthood about the future, we talk about this being the healthiest generation. We know that young people need our support to receive information and to access and services earlier than they have in the past. And we know that we face the greatest obstacles right now at accessing health care and rights everywhere in the world, including in the United States. And we need to empower this generation to protect itself. So for us in the United States, this means supporting young people not only with youth-friendly services, but supporting young advocates, like we heard yesterday, to make their voices heard by our government. As our last election showed in the United States, young people are a powerful voice of change, and we know that young voters and women voters have the power to make the difference, to ensure that we elect leaders that support our needs and who will create lasting policies to protect us and our families. So I am optimistic about our generation because I meet so many amazing young people through the work that I do with Planned Parenthood Global, and many of the organizations that we support are actually youth-led groups, leading innovative programs to reach their peers. So they're not just providing information, but they're actually delivering services. They're talking to their peers and providing them the commodities that they need. In the U.S., we help to organize high school peer education and college campus organizing committees around the country. And these groups are actually cultivating young leaders who can stand up for the health and rights of other young people in the country. So when opponents of women's health try to slash U.S. foreign assistance for international family planning or try to eliminate contributions to UNFPA or try to bring back the global gag rule, these are the young advocates that are out up front making their voices heard. And so we focus on young people because we know that they are the key to ensuring that we move forward and not backwards. As well, the internet and smartphones offers another way for us to reach young people. Through Planned Parenthood Online, we see more than 5 million people a month online seeking health information. And every 2 weeks, we get significant hits from every country in the world, increasingly more and more through mobile phone usage. In fact, the Spanish version of Planned Parenthood Online gets 80% more, 80% of the traffic is from young people in Latin America versus the United States. And what makes this site so different from other mHealth projects is that it actually directly links young people to the health services. So through new geographic positioning, after every application on pregnancy or sex or online chat, the person is directed to a center where they can receive youth-friendly services. So let's not forget the focus in Cairo, and that reproductive health is human rights. And we know that evidence shows that women invest in communities, and communities that invest in women see exponential results, whether it is for their country and their communities or for their direct families. And I'm glad yesterday we had some conversation about linking reproductive and sexual health rights to the environment, because these are connected in inexplicable ways. So the health and well-being of individuals and community and advancing empowerment of women means that we must deal with the environments that they live in. So we know that from the housing projects of New York City, where I live, to Amazon rainforest in South America, women of color, women from lower resource communities, rural indigenous women face the greatest obstacles to accessing information in healthcare. We also know that addressing their reproductive health needs in a vacuum is not the solution. Our programs must be integrated, they must be innovative, and we must address the environmental factors that impact them and their families. So access to birth control is less meaningful without access to clean water and education, or the assurance that your children are safe at night and not living in violent societies. So in order to achieve our goals, we must be nimble and combine our efforts. In the U.S. and around the world, we must be efficient with our resources. In the field of reproductive health and rights, we need to partner with education and other empowerment groups and harness this new global focus on the particular needs of young women to ensure that any programming aimed at investing in girls includes meeting their pregnancy and STI prevention needs. We need to involve men in our efforts and acknowledge and address their health needs and rights as well. We are especially working hard to get services for single parents. In the United States, single parent homes are mostly run by females, but there is an increasing need to both provide and link the services that they need, and as well for male-headed single-family households. And these men have to be addressed as well, as they are leaders, and particularly in the religious and political communities, and they have to be part of the conversations at the local level so that we bring them along as we talk about the needs for a much broader and integrated reproductive health agenda. So as we look ahead to our next phase of development goals, we need to get specific. We need stronger language on sexual and reproductive health and rights. And the next generation of global development goals, we have to be vocal advocates from this room and from many others to ensure that that happens. We have to make sure that these rights are cross-cutting and an integral piece of achieving broader development goals. And we must be explicit in stating this. And we must repeat ourselves, as I have, because this message must be heard and echoed throughout the new set of UN documents that drive our work for the next 10 or 20 years. Access to safe abortion and post-abortion care must be part of this call to action. Women like Savita or Beatrice or others have shown us what is at stake, and we must fight to honor their suffering and ensure that around the world we stop the politics and focus on the work that needs to be done. So I will stop there as I've gotten my call, and thank you for your attention. I look forward to the presentations to come and discussion if we have time. Thank you.
Latanya, for this really colorful and introduction to the issue, which shows how many aspects are involved, how many views, how many people and aspects, as well as giving us a view ahead of what needs to be done. This morning session is structured similar to what how we proceeded yesterday when we talked on population dynamics and and sustainability. It's, I will, after this inspiring introduction by Latanya, ask two, my ears are too small. To discussant to give us, to provide us with more input, and then ask voices from the floor to contribute. So we are proceeding in the same way as we did yesterday, just for your information, so that you know how the rules and regulations are for this session. Yeah, our first discussant is Adriane Martin Hilber. She's on my right side and on your left-hand side from your view. Adriane Martin Hilber is a senior specialist in sexual and reproductive health at the Swiss Tropical and Public Health Institute. She has over 20 years of experience in the field of sexual and reproductive health and rights. She has worked at all levels, from grassroots NGOs in developing countries to international NGOs such as IPPF and international organizations like WHO or UNECE. She has extensive experience in health and policy analysis, social determinants of health research, community health promotion, project management. I stop here. It's important for you to know that she also participated in the second thematic expert meeting on families, sexual and reproductive health over the life course, which was convened as part of the ICPD Beyond 2014 review process in the UNECE region. And she will present the main outcomes of that meeting. So the floor is yours.
Good morning, and thank you very much for inviting me, and good morning, delegates. So as said, I'm here to report on the expert group meeting, which was on sexual and reproductive health across the life course. And I have decided to structure the presentation around promises, progress, and challenges and potential. First, I wanted us to remember what was the promise foreseen in ICPD around these issues, and then where are we now? What is the progress? What are our existing challenges? And then what potential do we have for actually moving the agenda forward? So first, I wanted to remember what was the promise. A major achievement of ICPD in 1994 was the formulation of a consensus definition for reproductive health, which was based on Mahmoud Fatala, the then director of WHO's Reproductive Health Department, his definition from 1988. And it was that reproductive health implies that people are able to have a satisfying and safe sexual life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. The fact that 20 years ago there was consensus on this definition was in fact setting the way and the agenda forward for all of us. Implicit in this definition was individual rights and choices as the way to ensure a healthy sexual and reproductive life, and as a best way to address population dynamics. So I'll bring us back now to the European, the ECE region. And I wanted to, because in the consultation we were also quite focused on what was happening within the region. It was noted the context, the profound transition period that most of the region has experienced, that for most between the 1990s were years of economic hardship, and that was followed by a recovery in 2000, and that in fact this economic turmoil resulted in profound social changes in values and norms that were then accompanied by legislative changes. And I think we can't underestimate how those changes have impacted social, economic, and cultural life in many countries in our region. But many challenges remain. So some key facts that were brought up during the consultation. We are in a region of low fertility. There's sustained availability and increased use of modern contraception, particularly in the eastern part of the region. Abortion rates have declined, but it's important to note that inequities are significant, and particularly among the more vulnerable populations, perhaps the ones that need it the most. We have consistent high rates of STIs, sexually transmitted infections, and HIV. The proportion of teenage mothers has decreased and is low on average, but adolescent birth rates remain high in some regions and again among some subpopulations. And the weakness of rights-based policies for removing health and economic, financial, and social barriers that limit choice continue. And we need to expand beyond traditional population policies to include social welfare policies covering vulnerable groups, and specifically youth, LGBTs, older people, people with disabilities, and women. So, now I'll talk about the life course and how the promise, potential played out in our region. It's good to remember that all of the context in which we are working. ICPD pointed out that the family is the basic unit of society and as such should be strengthened. It is entitled to receive comprehensive protection and support. Already 20 years ago, they noted various forms of families exist. This is a point that Anne will talk about in greater detail, so I won't focus too much on it now, only to say that family forms are changing, that today people are delaying childbearing, there are higher levels of infertility, and now the dialogue has shifted to not only what are the causes of infertility, such as untreated sexually transmitted infections, abortion, as well as how that has shifted the dialogue to create a demand for reproductive technologies. And finally, the issue about migration patterns and how that has affected family dynamics in the region, particularly for women-headed households, and what the effect is on the remaining children and older people left behind, as well as what happens when the families come back, when the parents come back. So when we talk about youth and adolescence, the promise of ICPD had already noted that children, and particularly girls, are the key to sustainable economic development and growth. That was 20 years ago, almost 20 years ago. Now, 18 years later, at the 45th session of the Commission on Population and Development that tracks progress on ICPD, a historic resolution was adopted with governments that recognized for the first time the right of adolescents and youth, regardless of age and marital status, to have control over and decide freely and responsibly on matters related to their sexuality, including sexual and reproductive health. This landmark consensus actually has paved the way for us now, as we go forward, to firmly cement the issue of adolescent sexual and reproductive health and rights as human rights issues. We reached consensus last year, and I think it does set the stage for a more progressive and rights-based platform to speak about adolescent sexual and reproductive health. But what has been the progress and the challenges in our region? The number of young people in the world is at an all-time high, and many have access to education more than before. There's improved data collection on sexual health. We have high levels of well-being among young people. There is a lack of comprehensive sexuality education, though some sexual health information is getting into curriculum. There's limited access to sexual and reproductive youth-friendly services, although it is on the agenda. We continue to have restricted legal barriers, particularly for young people to access contraceptives. And we continue to have social and normative barriers, stigma related to adolescent sexuality, which impacts on behavior change. So what is the potential in terms of young people? I focused on three things. One is comprehensive sexuality education. The other is the right to access youth-friendly services, information, and including contraception, safe abortion, STI, and HIV prevention. and ultimately to limit adolescent pregnancies and child marriage through proactive laws and policy protections. Those are the three areas that in our consultation we focused on as the way forward in promoting youth, adolescent and youth sexual and reproductive health. So now in adulthood, we've transitioned from youth to adulthood, and we talk about healthy sexuality, reproductive choices, and access to services. Here, when we talk about the promise of ICPD, it was the connection, the most significant point was the connection between reproductive health and human rights. In terms of progress and challenges in these areas for the region, the issues that are most significant remain that HIV/AIDS is the most important problem that we are facing. In our region, there is a disturbing differences in the rates of STIs among subregions. And in fact, the number of people living with HIV has almost tripled since 2000. It is a concentrated epidemic, but one that certainly demands a lot of attention. There are issues of information, social stigma, and gender, which also has created barriers and restricts choices. We have access to SRH services varying among the different populations and subregions. Financial mechanisms and integrated services continue to be a challenge, as well as the legal environment and participation of affected groups. That was a big point in our meeting. We had a number of subgroups, subpopulations that were from sex workers to others that were participating and were really speaking about the need to have their voices heard. An interesting point was we are sympathetic, those of us, and then we want to make changes in the laws and policies to protect, for example, sex workers. And then we were told that some of those changes actually have a perverse bad effect for them. And so it's important to involve the affected populations to know what, in fact, would improve their chances and their access to good services. So when we look at the potential for healthy sexuality, reproductive choices, the areas that we can think about for the future is to focus on universal access to sexual and reproductive health and rights that recognizes access to quality services, including maternal and newborn health, family planning as human rights issues. We need to remove service-level barriers through the integration of sexual and reproductive health into primary health care and by investing in health system strengthening more broadly. To remember, sexual and reproductive health need to be supported through the entire system, which is from health information to the workforce. All of these issues will contribute to creating access. Another major issue is the challenge of restrictive gender norms to equitably allow for sexual and reproductive health life choices, and the importance of creating and enable legal regulatory environment to respect, protect, and fulfill people's sexual and reproductive health rights. So then we went on to older age. We had a number of very good presentations, as we did yesterday, on the needs of older people. When we think back to ICPD, we noted that there was very little attention given to sexual and reproductive health rights of older people. Yet our population is getting older. On average, the elderly are healthier, yet inequality exists, particularly among the poor and more vulnerable, marginalized older persons. So we have an opportunity in this next round to actually address their needs. It has previously, their sexual and reproductive health needs have been neglected. The media has largely given negative projections of and images of who are older people, they're a drain on society, etc. This can be reversed. We are getting older. I say we now. And we also need to think about who is supporting the older people as they get older, which are largely women, the same people responsible for the children and the adolescents. So we need to be able to give support to those caretakers. And we also need to keep older people within their own context, within the family, within their communities, to make them vital resources for the community. And there is an urgent need to support their rights, particularly in access to services and protection. So, I'm finishing. So where are we? Today, we have 1.8 billion young people between the ages of 10 to 24 who do not have access to comprehensive sexual and reproductive health services and sexuality education. 215 million women who are married or living in unions who do not want to be pregnant but lack access to modern contraception. And too many women and girls who continue to face gender inequality, violence, and other violations of human rights. There is a need to generate political will, sustained action, and accountability for universal access to quality, integrated sexual and reproductive health and HIV services. We need programs that empower women, especially through comprehensive sexuality education that is age appropriate and throughout the school years. We need to provide protections for reproductive rights as human rights. And we need to urgently adopt language that shows that sexual rights are human rights. We need young people's leadership. It was very promising to have people here. We need people to be more involved and participate as civil society organizations, as vulnerable populations. We need people's voices in how we plan for the future together. And finally, we need to recognize that sexual and reproductive health begins at birth and goes through older age. And the services that we provide and the rights that we guarantee need to recognize SRH throughout the life course. Thank you very much.
Thanks a lot, Adriane, for not just sticking to the time, but also to be so precise in sharing with us what has been discussed, the outcomes, the recommendation from this thematic discussion. And I'm pretty sure that you all have seen in the conference documents on the table that of all these thematic sessions, there is a summary included in this document it's on the table right now. So I'm now moving to our second discussant before we open the floor here. It's Professor Anne Gauthier, and she is senior researcher at the Netherlands. I never know what NEEDY exactly means, but now I read it fully out for you so that you all know what this abbreviation is about. It's the Netherlands Interdisciplinary Demographic Institute, well known as NEEDY for me. She obtained her doctorate from the University of Oxford in 1992 and has since then held teaching and research positions in Great Britain, Canada, the United States, and the Netherlands. And she has published widely in the field of comparative family policy and fertility, and is currently working on the projects examining trends in parental investment into children and trajectories of children's well-being. And she is current international coordinator of the Generation and Gender program, and she will share with us what is when we are talking about family, what does it mean nowadays? So thank you. The floor is yours.
Thank you very much, Mrs. Chair. My comments today will be focused on Chapter 5 of the ICPD Program of Action. More precisely, what I will do is to reflect on the changes in the family since ICPD and discuss some of its implications and some of the reaction of the governments. Now, when thinking about changes in the family, I like to go back to pictures like these, showing very large families with very short spacing between birth. Now, the little one on the picture is my mother-in-law, who was born just after World War I. I like also to think of mothers at home looking after their children, or the other pictures of daughters at home waiting for a marriage proposal in order to leave home and form their home family. Now, obviously, the world has changed since then. We have much smaller families on average. Many women nowadays do not stay at home, but instead have a paid employment outside of the home. And many young people, including young women, do not stay at home, but instead leave home before they get married or into a partnership. So obviously, by the time of the ICPD conference in 1994, the family had already changed considerably. For example, what the graph shows here is the rapid increase in the use of modern contraception was already well underway by the time of ICPD. Now, looking back at the family, we can say that it has changed in three fundamental ways. It has changed in terms of its increasing diversity, its increasing postponement of key demographic transition, and its increasing instability. So my talk will be focused on these three dimensions, and after that I will talk also about governmental support. So the first major trend is one of increasing diversity and increasing complexity in family forms. When we think about the family today, we have to think about small and large families, about one and two parent families, intact and recomposed families, single and dual earners, married and cohabiting couples, heterosexual and homosexual families. Now, this trend is happening in all countries, although at different pace, and there are certainly very large variations within countries. Now, to illustrate a bit this diversity, here is some data from Canada, a country that is relatively average when it comes to changes in the family, so certainly not extreme. Now, among children aged 14 and over living in families, in 2011, 16% were living with a common law parents. In the province of Quebec, this reached even 38%. So we're no longer talking about a small group, we're talking about a large proportion of children living with parents who are not legally married. There was also in 2011, 1 in 5 of children living with a lone parent and 1 out of 10 in a step family. These figures are obviously snapshots, that is capturing the situation at one point in time. When we instead use a life course perspective, we find that much higher percentage of children are experiencing various family forms throughout their childhood and various family transition. In other words, the key message here is that we can no longer talk of the family, but instead talk of a multiplicity of different family forms. The second major trend is an increasing postponement in family formation and more generally in demographic transition. For example, young people for the process of so-called transition to adulthood, that is forming their own independent household, is taking place at a later age. Young people are marrying at a later age, and they're also having their first birth at a later age. The graph here captures the mean age of women at their first birth in 3 countries. What we can see here is a clear postponement towards a later entry into motherhood, but again with major differences between countries. So the trend is similar, but the level is still very different between different countries. What's important here is that this postponement in key transition have fundamentally changed the image of what is a family. For example, the parent who is expecting her first child is no longer a 20-year-old just having graduated from high school, but is often a 30 or even 35-year-old woman already having a good career. So these are important to think in mind when we think about the change in the family. Now, from a societal perspective, some of these changes are welcome, especially since they have corresponded, among other things, to a decrease in teenage fertility. On the other hand, some of these postponements have been raising concern, especially if we think about the young generation currently affected by the economic crisis, for whom this postponement in key event in forming their own family may be due to external circumstances, such as not having a stable job. The third trend is that of increasing instability of families. We're thinking here about increasing in divorce, in union dissolution, but also increasing in repartnering and more complex sequence of family formation and dissolution. Again, this increasing instability has been observed in all countries, although at different levels. Now, these changes in families, and especially the increasing diversity of families, are important because we're not here dealing only with statistics, but we're dealing with real people behind these demographic trends. In particular, the changes in families are raising three fundamental issues. They're raising the issue of vulnerability. For example, think about the vulnerability of children caught in the middle of a divorce, the vulnerability of a single mother whose ex-partner is not paying the child alimony, or the vulnerability of the divorced father who is struggling to keep access to his children. Now, the legal instruments have to keep up with these changes in the family. There's also the issues of barriers. As I said, economic barriers that prevent, for example, young adults from forming their own families, or barrier confronting families, especially when it comes to the combination of work and family responsibilities. There's also the continuing issue of gender inequality, both inside and outside of the home, in the rearing of children and in their full participation in the labor market. In view of these changes and these new reality, the question is, what have government done to respond to that? Now, there are four major ways by which governments are supporting families. They're doing so through financial support in the form of direct cash transfer or tax relief. They're doing so in terms of work-family reconciliation, measures such as maternity, parental, or child care leave, measures which were already in place by the time of Cairo, but which have gained a lot of prominence on the agenda of governments since then, but where there's still a lot of room for improvement. There's the issue also of early childhood education and care, something that we were not talking a lot about at the time of Cairo, but something that is rapidly gaining importance, reflecting here the importance of quality care for children's development. And as I said, there's a whole issue of the legal rights of families that should reflect this new diversity of families. And of course, there are a lot of differences across countries in how governments have been responding to these changes. So for example, some countries have been actively supporting the participation of mothers in the labor market and encouraging more fathers to take up parental leave. Some countries have been granting equal rights to common law parents, just as for married couples. And some countries have been more successful than others in making sure that all children, including children from vulnerable groups, have access to quality early childhood education and care. The situation is, however, evolving rapidly, and it is clear that we need the appropriate tools to monitor changes in families, but also to monitor governmental response. So when we think about the new agenda, we need to think about what we need in terms of data. And particularly, we need data that adopt a life course perspective so that we can follow the trajectories of people over time as they move from one family to the other, as they experience one family transition or the other. We need data that are available for all countries, but data that are also based on large sample size so that we can study specific family forms, for example, single parent aided by a father, or specific population subgroups, for example, children in migrant families. Now, one of these data sources is the Generation and Gender program that is supported by the UNECE and which currently covers 19 countries. That type of data is essential if we want to better identify the needs and the vulnerability of different families and to help individuals negotiate these nowadays complex patterns of family transition. In other words, what we need here is a strong commitment to make sure that protecting and supporting families remain high on the agenda of our government. Thank you.